You're welcome back to Business Morning. And now, let's go straight to the first conversation. Talking about medical tourism on the rise as patients seek affordable quality care abroad. And still talking about Nigeria at 65. And medical tourism is gaining global attention as more people travel across borders to access affordable and specialized healthcare, from cosmetic surgery in Turkey to advanced cancer treatment in India. Patients are increasingly seeking medical services outside their home countries. Experts say the trend is driven by rising healthcare costs, long waiting times, and the search for advanced technology and expertise. Countries like Thailand, Mexico, and the United Arab Emirates are emerging as major medical tourism hubs, offering not just treatment but also recovery-friendly hospitality. However, health professionals warn that patients must carefully research accreditation, follow-up care, and possible risk before embarking on medical trips. Analysts predict the industry could grow into a multi-billion-dollar market, reshaping global healthcare access. And now joining us this morning to discuss is Dr. Salome Odafen, a passion-driven medical professional in the diaspora. You're welcome to Business Morning, Salome.
Hi, Destiny. Thank you so much. I'm
Very
glad to be
quickly, I'm so happy to have you. Now, medical tourism is projected to surpass $200 billion globally. What key factors do you believe are fueling this growth?
Well, I think you mentioned a few already with your introduction. But I would say the major fall for this is solution. So one of the reasons why the healthcare space is so important is because it's health, as in people want to get better, people want to feel better, people want to live better lives, people want to give themselves better quality of life. So wherever there's a solution to their health problem, they will be willing to also go. And also it speaks also on the quality of services being offered by some of these countries. Thailand, for example, that you mentioned, has been known to actually have good quality services in, I'm not sure, can you hear me,
Yes, I'm,
Destiny?
I'm hearing you very clearly. Go ahead.
Okay, so Thailand, for example, has been known to provide very good quality services, despite being quite affordable. So people will look for solutions, and people will also look for where they can get the best, even while seeking for solutions. So if I'm going to go to a country and I have the chance of getting cancer cured, then definitely if it gives me more time with my family, if it gives me more time to do things that I want to do on the earth, then I would definitely go for it.
Oh, wow, that's nice. So now how can countries balance the influx of international patients with the healthcare needs of their local populations?
Okay. So I think really this has to do with the on the borders of ethics. And currently I'm doing a lot in the ethical space for medicine.
Okay.
So I would say this really borders on ethics. And one of the major ethical principles when doing medical practice is justice, the principle of justice. And that means being fair and ensuring equity. Now, how can the government be sure that, okay, these hospitals are not just going to ignore locals and then take on international patients because of the revenue? So one of the ways that I would suggest countries could do this, or governments could do this, is, for example, ensure that hospitals that are known to do medical tourism, they also have a quota that is allocated, a composite quota that is allocated to the locals, a composite quota of bed space and time that is allocated to the locals. So that way you ensure that even though you're having influx of international patients, also you have care for your locals as well. Then also another way you can say that countries can do this is put levies on these hospitals, on this medical tourism. So put like some sort of tax on it. It
Mm.
might not necessarily be so high, but then the taxes that you use this to actually fund your primary healthcare centers. Now, one thing that many people don't realize is that primary healthcare centers are one of the key factors for improving healthcare for locals. So a couple of people within the country would not necessarily need the help of a specialist immediately. They might first need, and the first contact they will have is with the primary healthcare center. Now, if you can strengthen your primary healthcare, then you can also strengthen the quality of health that your locals are receiving. And then creating ways to fund this sector is another way to improve your healthcare while still being known as a hub for medical tourism and while still being known for improving specialist care. Then also another way is that in the primary healthcare center, you can also fund trainings for general practitioners within the country, and some of these trainings of give scholarships to young kids that are interested in going into the medical field, fund some of this their medical education. So by the time they're coming out, they are available for your locals as well.
Oh, wow. Then, what infrastructure investments are most critical for any country seeking to position itself as a medical tourism hub?
But I would say it would vary by country, really. It
Okay.
would vary by country, and it would vary on the aspect the country is trying to the field of medicine the country is trying to portray themselves as a tourism hub.
Okay.
So, for example, you mentioned, okay, Turkey for cosmetics, you mentioned India for cancer treatment. So, countries do tend to pick their specific niche in which they want to be known worldwide as a hub for. But apart from that varying by country, but I think one thing that will be important for every country to know is you need to invest in your human capital. So you have people in your country, you have medical practitioners in your country. What are the investments you are making on specialists to be able to have such skills? What are the investments you are making technology wise? So what are the equipments available in your country? So you have to be thinking of, okay, we are investing in human resources, we are investing in technology. And another important thing is you need to invest in research. Why people are coming to these countries is because they've been able to provide solutions. How did they discover these solutions? Research. It was research, somebody funding research, somebody going through the process of researching and looking for ways to improve people's health. And then when they found this, they were able to implement this into their healthcare system. So you need to be able to invest in research, you need to be able to invest in human resources, and you also need to be able to invest in technology. Now, this will not also not depend on the area the country really wants to portray themselves as a field.
Oh, wow. Okay, then what role should government play in regulating standards to ensure patient safety while still promoting competitiveness?
Well, I would say it would be important for, first of all, to ensure that these centers are well accredited. So, setting up accreditation bodies to be sure that these hospitals are delivering standard care. So, no matter the country, there are certain standards of medical care that you must give to every patient, and there are guidelines with this, international guidelines within the country. So you must actually investigate and see, are these centers following the standard medical care both internationally and nationally. And then also another area that the government can play an important role is ensuring that many of these centers outcomes and release their outcomes to see whether they are actually being effective, to be sure that they are not actually ripping people off. So if you are known as a center for creating care for cancer, how much what is the percentage of outcome that you have been able to get? Like, how many patients have gotten cure from coming to your center? How many had to have, so we have to take like proper statistics. How many people had to be readmitted? What was your follow-up like? how was the continuity of care. So government has to closely monitor this to ensure that people are actually getting the proper care, and it is just not a money making hub. So those are some of the ways I would say government can do that. Destiny? I'm not sure I can hear you anymore. I think I've lost you. Okay, I think I can hear you now.
Okay, so talking about, I just asked you a question. Can you hear me now?
Okay, I can hear you now. Yes.
Okay, Salome, you can hear me, right? Okay, then I said, what makes a healthcare destination attractive to international patients beyond just affordability?
Okay. So all this I mentioned is the quality of care and how well you're able to portray that in the media space. So one of the reasons why Thailand is so well known is because they had people that did get better, and they were able to like give them a better image publicly, and speak to the care that they received there. So what are people saying about your center? um the people actually get better? I mentioned earlier too that people do just want solutions. The reason why I would leave my country and travel to your country for health care is because I want a solution to my health problem. So the question is, are you actually providing solution? So that is the first question in anyone's mind. Like, would I get better? That's just the basic question. If you see someone coming to your hospital, to your clinic, the question is, would I get better? I don't want to spend money. I don't want to travel for hours not being able to get better. Then another thing I would say is having better follow-up care, as well as resources for care while within the country. So what are the available hotels in the area? Basically, also, what are just the tourist sites? Is the area calming? Is the area like peaceful? If after I do get my surgery done, is there a place for me to stay? What is hospitality like in that area? Is there a place for my family to stay if my family members do follow me? Then also another thing you would really like to look at is the visa laws, and how quickly people are able to actually get visas, and the cost of that, as well with the cost of flying over to that country, the cost of traveling over to that country. That will make them attractive. For example, India, I think India's e-visa takes about 3 to 5 days to come out. And that doesn't take too long. But if you want to compare that to Nigeria's e-visa, that takes about 15 business days. Then, so if I'm coming to your country for care, would I spend more time trying to get a visa before I even get to the hospital? So some of those things are what people really consider. And also, what's the proximity like? Are your airports accessible? These are
Okay.
things countries really need to consider if they are going to be like attractive for
Okay.
patients to come, and most importantly, just providing solution.
Okay then. But then in what medical tourism do you think Nigeria as a country can offer? And also, what lessons can emerging economies learn from established medical tourism destinations like India or even Thailand?
Okay. For Nigeria, I feel personally, I think Nigeria has like it has such a wide potential. We have the human resources. We have the minds ready to learn. So I really think Nigeria's opportunity is endless, but there are a lot of things that are hindering us. And if we can fix things like electricity, basic things, electricity, water, how the hospital runs, the management of the hospital, I think we first need to fix the basics before we can become a hub in that sense. We have excellently trained some of best neurosurgeons in Africa. We have some of the best minds in Africa, really. So Nigeria's opportunities are endless. We just need to actually fix the basics. Then can you repeat your second question? Let me just be sure I got that well.
Them as a very good tourism destination. Can you hear me?
Okay. Okay, I can hear you now.
Okay,
Because
now.
first,
All right. I said, right? I said, what
yeah.
lessons can emerging economies learn from established medical tourism destinations? You know, economies like Nigeria and maybe other emerging economies. What lessons can they learn from medical tourism destinations like India or Thailand?
Okay, okay, all right. First of all, invest in your healthcare, in your healthcare system. That's the first thing. Invest in your resources and um invest in your resources, in your human resources, in your in technology, invest in infrastructure. And also I think a major one to learn from India and Thailand is their tourist visa policies, and the process, the ease in this, and how many of them also. Another thing that Thailand has been offering is wellness care as well. So bring something unique to the table apart from presenting care to people, but bring something that people are like, okay, this is an added benefit for me for coming to the country, for spending money to come here, and make it affordable. That's one thing that we could learn from Thailand. Make it affordable. Give people quality service, but make it affordable. We have the tendency to want to overcharge foreigners, to want to expect people that are coming from outside the country to bring more money. But what we can do is to encourage this booming area in our country. We can actually reduce, like we can actually create these services at an affordable rate, both for locals and both for international patients.
Okay, then, so that how can digital health and telemedicine expand the reach of medical tourism beyond physical travel?
Okay. One of the ways is consulting.
Okay.
Um, Online, as like now I'm speaking to you and I'm not in the same room with you.
Yeah.
And this is something that can be done collaborating with local providers, local healthcare providers in another country. I mean, being able to share patients' medical records. There might be the issue of confidentiality, but then if it's between two medical practitioners that are working together to ensure the health of this patient. For example, if I know my patient needs a particular surgery and we do not offer this surgery in Nigeria, I do know another medical practitioner. I ask my patient's permission. Oh, we have a medical practitioner in India and he might be willing to take a look at your case. If you like, I could send some of your case files to him and some of your results to see whether this is something they can work on. And then create that avenue just to be able to speak to the patient online, review the patients, and that back and forth, that collaboration. It's a way to actually, because then once you start doing processes like that, even before the patient decides to travel, for example, for surgery or for care, there's already care the patient is receiving before meeting you. So that also puts the patient at a better chance of recovering as well. Yeah.
What policies would you recommend, you know, to ensure inclusivity and sustainability in the business of healing?
Well, I think, well, policies policies should really focus on the area of equity. That's what I would say, ensuring equity, because it's very easy for us to like focus on the business aspects, making money, but we must ensure equity, and we must ensure that people are actually getting the solution they need. We are not just creating a money reaping area, but we are actually caring for the health of these people. First and foremost, every policy should view the patient not as a business, but as an individual that needs health and needs to feel well. So whatever policies we're doing, first of all, should focus on equity and should focus on ensuring healthcare. So in the aspect of equity, one of the things I mentioned is ensuring taxes on medical tourism in a way that it's able to benefit the locals. These taxes are used to fund primary healthcare centers and care for locals as well. Then another thing in the aspect of ensuring health, these people are actually getting better and ensuring the health and well-being of individuals is to create a policy that mandates hospitals to release their outcomes. How many patients came in for this? How many got better? What were the cases of reinfection or readmission? What were the things that were done to mitigate? Just make sure that countries actually release reports, sorry, not countries, rather, hospitals release reports on the care that they are giving individuals.
Okay, so lastly, how can local healthcare systems avoid brain drain while also attracting international talent?
This is a very interesting question.
Very, very.
I mean, Nigeria is one of the areas that really suffer from brain drain. And one of the ways, there are so many ways, but one thing I would say, especially in the Nigeria context, is you need to invest in your human resources. Nigeria it has like the largest population for a Black nation.
Okay.
And even in Africa, we still have some of the highest number of doctors, though we are still complaining that we don't have enough, but we still have a large number of doctors. So compared to other countries within the African space. So now the question is, when you train these doctors, what is your investment in them? What is your investment in research? One of the things that moves the healthcare space, and that's one thing I think Nigeria can learn from countries like even the United States, is research is such a big deal, or it used to be such a big deal. So you have to actually invest in research. You have to, that way you are providing solution. Healthcare is really about providing solution. Many patients might not even know what you are doing. Some of them might not even care to know, though it's important for you to inform them. But what you find that some people don't even want to know. All they want is, I want to get better. I want to feel better. I want to be able to see my children the next day. I want to be able to see my husband the next day. I want to be able to see my mother the next day. So the question is, are you investing in your human resources? The average doctor in Nigeria does he have hands-on experience with the latest endoscopy procedures? Does he have hands-on experience with the latest surgical procedures now that AI is coming into play? What is Nigeria doing about maybe making this available for medical doctors in Nigeria to be able to create like research opportunities in this area for medical doctors so that they can advance healthcare in Nigeria? Things like this are very important, but we're not having these discussions, and we're not really investing in our population a lot. So it's a very dicey and difficult situation. But if Nigeria can actually invest in the human resources, in the individuals that are there, the healthcare professionals, the nurses, are the nurses also aware of the latest care for patients? Are the pharmacists aware of drugs? What are we doing about research in the areas of drug? What drugs work better for our population? We have a long way to go if we are going to actually be known as a medical hub.
I want to really appreciate you, Salome Odafen, medical practitioner, all the way from diaspora, joining us on Business Morning today and giving us so much information on business, on medical tourism. Thank you so much, Salome. Looking
Thank
at
you.
you,
Thank you. It
one
was a
will not
pleasure.
envisage
Thank
getting so much as we got from you, but
you.
you just gave us that shivers down there. I want to appreciate you because you've taught us so much this morning on Business Morning about medical tourism. Thank you and have a
Thank you.
great day.
Have a good day. Thank you.
Thank you so much. And that's the first segment on the Business Morning. When we come back, we'll be talking, having conversations on our second conversation, talking about Nigeria at 65, crossroads in our economy. We'll be right back. You're welcome back to Business Morning. Now, very quickly to our second conversation, talking about Nigeria at 65 and economy at crossroads. Now, Nigeria marked its 65th independence anniversary just yesterday, with President Bola Tinubu declaring that the worst is over for Africa's largest economy. Official figures show the economy grew by over 4% in the second quarter, its fastest pace in 4 years. Now, foreign reserves have also climbed to more than $42 billion, signaling renewed investor confidence. But behind the numbers, hardship persists. Inflation hovers around 20%. Food prices remain high. And an estimated 129 million Nigerians still live below the poverty line. In a major shift, the central bank has cut interest rates for the first time in 5 years, easing borrowing costs to encourage investment. The government has also reduced electricity subsidies and banned the export of raw shea nuts in a push to strengthen local industries. Now, energy remains a critical battleground. A threatened oil workers' strike was averted after talks with Dangote Petroleum, while solar power is slowly emerging as an alternative for millions left in the dark by Nigeria's fragile grid. Analysts say reforms such as fuel subsidy removal and currency unification are bold steps, but the challenge is ensuring that growth is felt at household level, with floods, unemployment, and poverty still weighing on the nation. The question remains, can Nigeria's economy at 65 deliver prosperity for its people? For now, optimism meets reality in a country standing at an economic crossroads. But then again, joining us is Muktar Muhammad, the CEO Finance by Muktar and a top financial expert par excellence. Good morning, Muktar Muhammad.
Thank you for having me, Destiny. My pleasure to be on your program.
My pleasure once again, especially
Independence Day. Thank you.
As Nigeria has turned 65, I'm happy to be speaking with an expert like you that will analyze deeply into Nigeria's economic crossroads. So now on economic growth and policy, Nigeria actually recorded one of its fastest GDP growth rates in years. How sustainable is this growth given inflation and unemployment pressures?
And Destiny, I think during your introduction, you've hit the nail on the head already.
Yeah.
You said the growth that the hardship is still in the land despite the growth. You have to look at this growth. Is it the real growth or the data-driven growth or the rebasing-driven growth? Because what about this growth, both in the area of GDP growth and inflation are all based on the inflation is based on the rebasing. The growth in GDP is also based on rebasing, and this rebasing is based on data that if you look by the data with the reality on ground, they are very different. So inflation is still there. It's still going on double digits. Despite we bringing the inflation to rebasing. Rebasing has seen our GDP in the fastest growing mode that we've ever seen before. So for me, it's all about data. But again, where do we get this data from? If there's any challenge we have in this country, is in the area of data.
Yeah.
But what they say the data is telling us today is what the president, what the economic team is telling us. But the reality on ground is that there is still challenges with the economy, whether in the area of inflation, whether in the area of GDP growth. You have to look at it. Yes, rebasing can grow your economy. Rebasing can bring in GDP coming down. But you have to see, what's the whole idea of rebasing? Rebasing is largely to getting new areas for investors, to get foreign direct investors to come into your economy to develop those areas that was not there before. And this current rebasing was driven by the rebasing in the oil and gas sector, largely driven by refined petroleum product and Dangote refinery, and also modular refinery, and also illegal refinery was also included as part of this data. And then you have mining also coming there. You have fintech also coming there. You have the entertainment industry that are also grown. All these were responsible for the growth that we see in this city, in the economy and inflation. But again, for you to maintain that growth, then we need to see investors come in through the sector to grow that economy. That's why that's where the job will come in. That's where inflation will come down. Destiny inflation in Nigeria is not driven by liquidity reduction or lack of or what we call a shrink in terms of supply chain, or is largely driven by currency volatility. And we have seen that we are enjoying what we're enjoying today because, again, we've seen that the currency are definitely stable or still getting to stability from the high that it was before.
Now, the Apex Bank, Central Bank, has cut interest rates for the first time in 5 years. So what do you think the impact should, what impact should Nigerians expect on businesses and even households? Will it hold
Honestly, normally we should be excited about the cut of interest rates, and you have to see that, and that's been the cost of borrowing has come down. And then we also look at that. It's not just the rate cut that is exciting; it's the reduction in the liquidity ratio also has come down from 50 to 45%. Also, we've seen that should help the financial sector lend to the risk sector. But if you look at that again, our banks really ready to lend to the risk sector because they also know that the economy is challenging. So it's not left for the physical side to come up with policy that would drive growth, that would drive lending. And some of these policies have to be in place, like you're looking at the cost of production, cost of energy is still very high. Even for the manufacturer, you have other challenges also that has to do with in transportation. Cost of transportation has not come down. Infrastructure is still a challenge, and the end user chain that will bring those products to the rural or the urban, from the rural to the urban area, are still challenges. So definitely it's good to cut rates. Again, in cutting your rate, we will see the banks moving most of their money from fixed income, from government security, into investing in the risk sector. From where I am now, Destiny, I don't think that will happen anytime soon. They are still looking at the risk sector of the Nigerian economy. Lending might improve, but again, will it be improving toward the smaller business? I doubt. It might improve toward the already established businesses.
And so do you believe government reforms such as subsidy removal and even forex unification are addressing the root causes of economic instability? Do you think that?
Well, if you're going by data, definitely they are. Again, data normally is the new way to look at the economy. If you go by data, definitely. But again, if you look at sector by sector, you realize that what we've seen that some sectors were favored by that two policies that you just mentioned. One of those sectors that have really benefited from this policy, the Nigeria financial markets, the stock market, the fixed income, and even the financial sector. You saw that when that policy came, a lot of the manufacturing sector, the risk sector, suffered a lot of losses because of that floating of the currency. Now we are seeing that gradual recovery. If you look at that recovery, what they are saying, definitely you will say, okay, it's driving us towards stability in terms of FX stability, and also in terms of unification of the exchange rate. You can see that now we are going toward between the BDCs and also the official central bank. We are seeing that conversion, even now if it's not yet there, but hopefully it will be there. But Destiny, the challenge with Nigeria has never been, we've not had the challenge of converging, but it's maintaining that convergence when we have external shock. That has always been our major challenge. But I think it's the if you look at data, definitely you see the economy is stabilizing. But again, you look at where they were at that time. What was the exchange rate when they came? But the exchange rate really market driven. Remember, the CBN said that what they were first of all looking at is to make sure we have a competitive FX market. Naira, a competitive Naira also. Now we've moved from competitive to stability, and we are seeing the Naira begin to stabilize. So you can see the CBN have been doing a lot in that area, but they need to be complemented by the monitoring side.
All right,
And that is where we'll begin
complemented
to
by
see
the money.
But again,
Okay.
great data, fine.
All right. Okay, now talking about inflation and cost of living, right? Inflation is actually cooling, but still above 20%. Then, what more should policymakers do to reduce this cost of living for ordinary Nigerians?
And this, maybe we'll go and learn from Ghana. I'm reading today that Ghana inflation has come down to single digits. So we need to go and ask them what they are doing that we are not doing.
If you think it's necessary, then why not?
Drive down by monetary policies. I mean, physical side, monetary policy have done what they have to do. I think the physical side still have a lot to do. There's no that synergy. You see sometimes monetary policy is trying to reduce inflation, physical policy, hiking rates here, there. Remember the FOB that was supposed to come in, the government that suspended it. Today, again, we are having issues that has to do with tinted glasses. All those are definitely going to have an effect on the economy. These are all monetary policies tools that are affecting the economy in one way or the other. I think now what we need to see monetary policy taking a bite of some of their revenue. If we want to see that desired growth, we want to see tariff also reduce. You want to see power come down. You want to see that cost of businesses come down, and that is going to be largely driven by the physical side. I want to see security improve so that we can begin to have supply from those cities that we used to have food supply, bringing them to the urban towns, and then good infrastructure so that cars will move, and then that will drive down the cost of transportation and all that. We need to see that from government before we begin. Then you begin to see the required result. But for now, what we are enjoying is largely driven by the monetary policy. Until the physical side synergize with them, we'll continue to have those challenges.
Then again, so over 129 million Nigerians, are living below the poverty line. How can economic policies translate into like very real relief for citizens? This is important, Mr. Muktar.
Very, very important. And when you see the president say each household was giving 32,000 naira, resulting to the numbers that we're saying, you begin to ask yourself, why have we not seen this reduction in poverty? I think again, corruption is still part of it. Then again, I still go back to the physical side. What policy have we been able to create to enact to create jobs? That for me is the major challenge that would drive people out of poverty. Destiny, you might agree, you might not agree, but now we have two classes of people in Nigeria, the very rich and the very poor. The middle class are non-existent, and it's the middle class that grown an economy. It's the middle class, once you start having middle class, that means you're beginning to create the very rich, the middle class, and so you are moving a lot of people from poverty. And the middle class thrive on jobs, thrive on consumables, because when you have those middle class, they are the one that consume more to grow your real sector. So for now, the middle class is non-existent, and the non-existence has to do with lack of job, and which have led to a lot of them leaving this country. So definitely, it has to be the physical side driving of policies that will encourage growth. That will also create the middle class. And so it's not just about throwing money at the challenges. We have seen that happen time, trader money, and that, but we've not seen the success of those stories. So now we need to see the success of those stories. We need not just throw money, but we need to enact policies that will help grow this, create a middle class, and then take people out of poverty. And that can only happen when we start creating jobs for those people to move from the very poor to the middle class.
All right. Now, one last question before I let you go. Talking about energy and infrastructure. You see, Nigeria remains dependent on oil, yet labor unrest and supply challenges persist. How vulnerable is the economy to these disruptions? Just give me this answer briefly, sir.
Destiny, you have to hit the nail. You have to hit the nail on the head. You have to say why is the Pengasin and others causing destruction in a sector that they have always cried that investment should come in there.
Okay,
We should
yeah.
have more refinery. But now we are seeing them, when we are seeing private refinery, they are fighting against the refinery for their own selfish good.
Yeah.
And that will not encourage energy security. That will not
At all.
encourage investment in that sector. If everything, I'm a private business, I put about $20 billion into that business, and you just want to go, actually you want to crumple that business because you feel that your union members are being unjustly treated.
Exactly.
And when you have the
Exactly.
industrial court, you have other places to go. So for me, that is the greatest challenge. There must be rule of law. There must also be protection of intellectual property for us to see that type of good. So for me, I personally think that the greatest challenge to Nigerian problems sometimes is Nigerians, and especially the so-called labor union.
Oh, wow. Wow, thank you so much, Mr. Muktar Muhammad. You are very, very indefatigable, and we really do appreciate you for your time always when we call on you on short notice. Thank you for everything you've said and how far you've educated us on Nigeria at 65 and the crossroads we're facing in the economy. Thank you and have a great day.
You too. Thank you, Destiny, for having me. My pleasure.
Thank you
Thank you
so much. Thank you so much, Mr. Muktar Muhammad. And right now, this is where we draw the curtain on Business Morning today. Thank you for staying with us as we track the latest trends shaping markets and the economy. Remember, business decisions are stronger when backed by the right information. I'm Destiny Momoh. Just stay tuned for more updates on the big story by Elizabeth Musa. And join us again tomorrow for another edition of Business Morning on the Breakfast Show. Good morning.